generation.
Okay. Okay, perfect. I think that
Mhm.
current, we only have time for one last
Oh,
question. And I know this went so fast. But so we've talked all about vaccines, but this patient really wanted to know your thoughts on what's most exciting in the treatment landscapes
mm,
the next 5 years or 10 years. Like where are we focused,
yeah.
even newer and better therapies? So what else is
I'm
going back?
so
Yeah.
Yes, I'm so glad you asked that because I did want to make sure I got in a moment to talk about this kind of treatment called an antibody drug conjugate. This is where our therapies are going. It's really fantastic drug development where an antibody, which our bodies make all the time to fight infections and to fight cancer, an antibody is designed against a target on the cancer cell. And then linked to it are a few small molecules of chemotherapy. So rather than having to give intravenous chemotherapy that goes everywhere and hits our healthy cells as well as our cancer cells, an antibody drug conjugate uses the antibody to bring the chemotherapy right to the cancer cell. So it is much more targeted. It's able to deliver a higher concentration of the chemo right to where it needs to be. And we have seen now several FDA approved antibody drug conjugates improve overall survival for women with triple negative breast cancer. So drugs like sacituzumab or trastuzumab deruxtecan, these are FDA approved, super exciting, and work better than chemotherapy. So there are a lot of new drugs in development like that. There are trials going on with a drug called Dato-DXd. There are studies looking at using these antibody drug conjugates earlier. So not just in metastatic disease, but since they've worked so beautifully there, start using them in high risk early stage triple negative breast cancer so we can try to cure more women. So I think we're going to see those drugs move up, and we're going to see combinations of those drugs plus immunotherapy. And hopefully we're going to see more targeted drug development based on mutations that the tumors develop.
Okay. Bright, bright future.